A stroke, also known as a cerebrovascular accident, CVA, is a very dangerous medical emergency. It occurs when the blood supply to the brain is interrupted or significantly reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. Here is a detailed breakdown of the factors that increase the risk of stroke. 1. Non-modifiable, uncontrollable risk factors. These are factors that you cannot change, but being aware of them is important for prevention strategies. Age. The risk of stroke increases with age, especially after 55. Gender. Men generally have a slightly higher risk of stroke than women. Family history. If a parent, sibling, or close family member has had a stroke, your risk is higher. Prior stroke or TIA. Having a history of a previous stroke or a transient ischemic attack, TIA, mini stroke, greatly increases the risk of recurrence. Race ethnicity. Certain groups have a higher risk, e.g., African Americans. 2. Modifiable controllable risk factors. These are the most important factors to manage and treat, as they account for the vast majority of strokes. High blood pressure, hypertension, this is the leading risk factor. High blood pressure damages blood vessel walls over time, making them prone to rupture, hemorrhagic stroke, or narrowing due to plaque buildup, ischemic stroke. Heart disease. Atrial fibrillation, AFib, this irregular heart rhythm is a major cause, as it allows blood clots to form in the heart, which can then travel to the brain. Other conditions like heart failure and valve disease. Diabetes mellitus. Diabetes damages blood vessels and increases the risk of atherosclerosis, hardening of the arteries. High cholesterol dyslipidemia contributes to the formation of plaque in the arteries, leading to narrowed or blocked vessels supplying the brain. Smoking. Nicotine and chemicals in tobacco smoke damage blood vessels, increase blood pressure, and promote the formation of blood clots. Obesity and physical inactivity. These factors lead to other conditions like high blood pressure, diabetes, and high cholesterol. Poor diet. Diets high in salt, saturated and trans fats, and sugar. Excessive alcohol consumption can raise blood pressure and contribute to heart problems. High stress levels. How to prevent a stroke effectively. Since many risk factors are controllable, adopting a healthy lifestyle and managing chronic conditions are the best ways to prevent stroke. Control blood pressure. Monitor your blood pressure regularly and aim to keep it stable, often below 140/90ths of a millimeter of mercury, or as directed by your doctor. This may involve medication and lifestyle changes. Eat a healthy diet. Increase intake of fruits, vegetables, whole grains, and lean protein fish, poultry. Limit salt, sodium intake, less than 5 grams per day is often recommended. Avoid saturated fats, trans fats, and cholesterol. Be physically active. Aim for at least 150 minutes of moderate intensity aerobic exercise, like brisk walking, per week. Regular activity improves blood circulation, lowers blood pressure, and helps manage weight. Quit smoking and limit alcohol. Stop all forms of tobacco use immediately. Limit alcohol to no more than 1 drink per day for women and 2 for men, and ideally, less. Manage chronic conditions. Work with your doctor to effectively manage and treat diabetes, high cholesterol, and heart conditions, especially atrial fibrillation. Maintain a healthy weight. Losing excess weight can significantly reduce your overall risk. Get regular checkups. Schedule routine medical checkups and screenings to detect and treat risk factors early. If you have multiple risk factors, it is crucial to consult your doctor to create a personalized prevention and treatment plan.